CAP urges CMS to standardize prior authorization for tests. HPV vaccination drastically reduced cervical cancer deaths in England. And a valuable research opportunity for pathology residents. These stories and more coming up next. This is Path News Network, Daily Edition from the College of American Pathologists. I'm Nick Lonnie. It's Tuesday, June 23rd. The CAP submitted comments to the Centers for Medicare and Medicaid Services last week, arguing for standardized, streamlined electronic test requisition forms. The CAP recommended that new forms be used for prior authorization of laboratory tests by Medicare Advantage plans and other insurers. The current lack of a standard creates barriers to medically necessary testing and administrative headaches for medical practices. That harms patient care and contributes to burnout among physicians and staff. The CAP also argued for more regulation of third-party laboratory benefit managers because they add unnecessary complexity to the process. The comments responded to a CMS request for information, part of a multi-year rollout of rules aimed at creating a standard system for electronic submission and approval of prior authorization requests. The CAP wants to hear about your experiences during the current reporting period for the Protecting Access to Medicare Act, or PAMA. Your thoughts help CAP's advocacy team document how PAMA reporting requirements affect pathology practices. Your stories can strengthen the association's case for reform. The CAP wants to know, first, how much time and staff resources you need to complete the reporting. Second, any challenges with data collection or technical issues. Third, whether you had questions about the information required. And fourth, any other challenges with the reporting process. Please share your experiences by emailing Justin Fisher, CAP's Assistant Director of Legislation and Political Action, at jfisher@cap.org. An increase in human papillomavirus vaccinations in England led to a substantial reduction in cervical cancer deaths, according to a new study. While HPV vaccination has long been shown to reduce cervical cancer, this was the first widespread study in the UK showing a correlation between vaccination and decreased mortality. Researchers at Queen Mary University of London used national data to compare cervical cancer mortality rates before and after a school-based HPV vaccination program was introduced for all girls in September 2008. No deaths occurred for women aged 20 to 24 years between 2020 and 2024, 90% of whom were vaccinated. That compares to 23 expected deaths based on historical rates. The researchers said that the findings support the achievability of the World Health Organization goal of eliminating cervical cancer as a public health problem. And finally, pathology residents have an opportunity to gain in-depth, hands-on experience in developing novel histopathology-based diagnostic assays through the CAP Foundation. The Foundation's Translational Diagnostics Advanced Training Grant will provide up to $5,000 for travel and living expenses during a 4-week training period at Ventana Medical System's Tucson headquarters. Participants will be able to tailor their experience to explore a wide range of topics, such as scientific and clinical affairs and digital pathology. The grant is open to residents in a pathology program who have completed at least 1 year of residency. The application window opens July 1st. Go to foundation.cap.org for more information. Now that's all for today. See the show notes for more information on today's stories. And if you've got a story to share, write us at stories@cap.org. We'll be back Wednesday at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nick Lonnie. Have a wonderful day.